Memory programs are very important. As our population ages, everybody has a sense that their memory may be slipping, or, parents' memory slipped, am I going to go that way? And the ability to evaluate people with memory problems is actually a critical part of our center. Most people with memory problems have actually seen their doc and either forgot to mention it or got brushed off because they're functioning normally. We would plan to have a much more thorough evaluating system. We will look at kind of memory problems. We'll look at the confounding factors. Often memory problems are due to medications, sleep disorders, lifestyle, depression, a whole lot of what I call fixables. So just having a memory problem doesn't mean you're just getting old. We can do a better job of being thorough about it, collaborating with sleep centers, collaborating with cognitive assessment teams to do memory disorders. In addition, I run a number of research programs on Alzheimer's disease. And these are cutting-edge treatments. They're sponsored by some of the major pharmaceutical companies. Some are sponsored by the National Institute of Health. But the goal is to identify very early cognitive problems, potentially what's called pre-Alzheimer's, and treat to prevent progression of illness or even to reverse some of the problems that have developed over time. So the project is really designed for a large number of people. Literally anybody north of San Francisco could come here to get this type of evaluation. Research programs by definition do not cost the patients anything. They're all funded externally, so it doesn't matter if you have insurance, what your insurance is. If you don't have insurance, it doesn't matter. Our plan is to take anybody and everybody who would qualify for a study and put them in a study. The people at University of California, San Francisco, who run a memory and aging center, have collaborated with me in the past and currently, essentially saying, we'd like you to take over anything north of San Francisco. They're full, and nobody up here is doing anything like this. So it's an opportunity for the entire community to be involved in memory evaluation and access to research programs. Memory disorder programs are rare outside of major university centers. So at Sonoma West Medical Center, we would be really unique in terms of being a community-based facility taking on a major condition that has been reserved for university hospitals in the past. So we're expanding that role into our community. The ability to do research is very important. It's important to me. It's something I've done most of my professional career. It allows us to be on the cutting edge of new treatments, of ways to prevent illness, of ways to treat illness, of ways to track how well we're doing. And so at Sonoma West Medical Center, we can incorporate all of that. So research right now is on memory disorders and Alzheimer's disease, but there are other programs in stroke, there are programs in Parkinson's disease, and there are programs in migraine, all of which could be moved into this facility as a regional hub for research outside of the university.